I'd like to welcome Dr. Len Bransowitz.
Thank you. Thank you. I had to ask Rashid, what was the name of that actor back in the 70s that used to always come over sunburned? And George Hamilton, he finally told me. I said, that's not me. I fell asleep on the side of the pool yesterday. Tracy saved my life. She almost pushed me in. But anyway, what I want to talk about today is a challenge that Jamie gave me a while ago, because it's very difficult to sit here and say that you've been practicing for 36 years. That's a long time. And to practice for 36 years and have some pearls within what you do that you can share with others. Because I've been to many seminars like this, and a lot of people just don't like to have somebody tell me how to run my practice. I know what I'm doing, I'm fine. So over the last 3 or 4 months, Tracy and I and Jamie have gotten together and said, just in casual conversation, what are some of the pearls? What are some of the things that you do that's different than others? And we wrote it down, and we wrote it down, and we wrote it down, and one of the biggies that came up was testing. So we're going to talk about testing techniques, some of the things that I've taught for many years, some of the things that I've integrated into my practice that has helped me to do a better job with my patients, some of the mistakes that I've made over the course of the last couple years. Mistakes that I made that lets people drop through the whole support team that I put together. So we're going to talk about those today. Hopefully you gather a few of these results that you can integrate into your practice. And for those of you that think that medicine, traditional medicine, hasn't really caught on yet, yesterday, one of the things that I read each and every day is the New England Journal of Medicine. And the intriguing thing yesterday, for the first time, the New England Journal of Medicine actually put out a little piece that said this: innovation is the constant goal in healthcare today, but the path to more effective, less expensive, more satisfying care goes beyond the latest smartphone apps. True innovation reimagines all the way that healthcare is delivered. And they're having a seminar where they say expert speakers are going to teach you how to integrate natural approaches into your practice. You will learn to redefine the meaning of healthcare and how it's delivered. You will move past technology's silver bullets toward meaningful and impactful innovation. You're going to look beyond just writing a prescription and giving advice that actually can be applied to your patients. We want you to rethink care delivery processes to achieve better outcomes at lower cost, with less waste and greater patient satisfaction. Medicine has finally, maybe, caught on a bit. Maybe they're going to start to appreciate what we all do. It's been one of the most intriguing things. My wife's in internal medicine, and the integration of her practice with mine has been a very difficult one. She has been basically in the internal medicine practice with one of the major groups in Atlanta, actually forbidden to refer to me. It's been one of those. The unknown of how we define what we basically do is crazy. So I pulled out a couple of my old presentations in the past, and one of those that I pulled out was the top 10 signs one of your patients need to find you as a new doctor. Number 10, the tongue depressors taste like fudgesicles. Number 9, the only suggestion under preventative care is an apple a day. Number 8, your doc is wearing the pants you donated to Goodwill last week. Number 7, the only expense covered 100% is embalming. Number 6, the bedpans are coin operated. Number 5, the hospital gowns are open in the rear and the front. Your Prozac, Xanax, and Lipitor are candy coated with little MS on them. Number 3, MRI results are drawn in crayon. Number 2, the waiting room has slot machines. And lastly, they really don't know about you. And that one hit home to me. You really don't know about me. You really don't know what I do. And that's been one of the difficult things. So when we look at what we're going to do today, we're going to share some info gathering pieces on specific disease-related patients. I pulled together 5 or 6 different true patients that Tracy and I worked with over the last couple years. In each one of these, there's various things we're going to try to highlight. Why was this case much better than any other case. Now, before I even get deeper into this, a review on statistic gathering, testing results, observations, we're going to get into all of that. Yesterday, I got a call from my staff, and I shared this with Jamie last night. I had a patient come in about 2.5 months ago, an 82-year-old woman who came in a wheelchair into my office. And I felt really bad, and she told me the story about how, and she broke into tears, that her husband was just diagnosed with cancer and she couldn't take care of him anymore because she was in a wheelchair. He had non-Hodgkin's lymphoma. And he was on multiple pain meds, which made him disassociate. So she said, you got to help me. Help me get out of a wheelchair. 82 in a wheelchair. So we took a look. I scheduled her for some testing. We did some very basic testings on her. We did a couple different support entities. I'll go into a little later what we did with her. But she came in 6 weeks later and said, I want to show you something. 6 weeks. She came into my office and got up and for the first time in a 1.5 years walked out. And I was taken aback. The rest of the story goes is that yesterday, one of my staff called me and she said, we just had this woman in the store who just spent $400. And I said, well, that's nice. You know, what did she get? She said she came in and bought 3 bottles of CBD gummies. You'll see them back here. And I said, 3 bottles? And she said, yeah. She said, do you know who this is? And she told me the woman, and I said, you telling me she walked in yesterday? She said she walked in, bought 3 bottles. They're not inexpensive. And she said that she went home a month ago and would give one to her husband with breakfast, one with lunch, and one with dinner. 3 of those a day. And in the course of 4 weeks, he managed to stop his 40 milligram fentanyl patch and his OxyContin 40 in its entirety. He was pain-free in 4 weeks. And I was astounded. I told Jamie this last night, and I said, I'm going to verify this and document this because this is impressive. So a little later, we're going to talk about CBD. One of the things that I've had to battle, and you probably have as well, there's a whole boatload of CBDs out there. And when you look at the price on a well-made product, it's very difficult to sit down and say, I have to convince the patient that this is worth spending the money on. So I don't work for Nutritional Frontiers. Jamie and I have been friends. Tracy and I have been friends. I have integrated Nutritional Frontiers products into my office. One of the biggest mistakes I've made over the years, and I'll call it a mistake, is inventory. I've managed to put a lot of inventory into my office at various times. And what I've realized over the last 5 or 6 years is that I can slowly whittle away that inventory, because when you find a company that has everything that you possibly need, at least 95% of it, for every one of your patients, it makes inventory control so much better. I have been a big believer in made in the USA and avoidance of Chinese raw materials. No offense to the Chinese people, but I do. You know, also in the New England Journal of Medicine today, again, are 12 more recalls on medications coming in with NADD in it, which is a toxic carcinogen, which is coming in from China. So we are importing a whole lot of different generic medications into our pharmacies, and they're now becoming a bigger and bigger problem. It wasn't just dog food. So with that being said, a big theme that you're going to see today is, how do I pick the right product at the right dose? And we're going to really stress right dose. Jamie made a comment to me a couple months ago about one of the pain products called X-Flame here, and he said, you know, that product in particular will 100% of the time stop pain if you dose it aggressively. Well, it says 2 a day. Well, I might have to go to 4 a day. And when you learn how to use these products as loading doses and use them specifically, you will find that you can get the results that you're looking for. Here's just the pearls. This is when we sat down and said, what are some of those tips? How do you know when to order the correct testing? You know, we're working in a world where they may have already had blood work done 2 or 3 months ago. And for you to come in and say, I'm going to order more blood work and try to bill their insurance, you might get into one of those gray areas. And someone here this morning said, well, when you order blood testing, How do you go about it? And we're going to talk about that. But keep in mind, the cash price for blood testing has gone down almost 90% in the last year. So most of these labs, LabCorp, Quest, or any of the other independent labs, to do a CBC and differential is now about $39. So you can get these things done if your patient asks for them, and they don't need a prescription in any state. You can just go in and have your blood work drawn. So keep that in mind as you try to direct your patients on what they need. I'm sorry? Oh, that's somebody outside. Oh. Knowing the right ingredients. This is a big point, for instance, with that CBD. You know, I had people buy CBD gummies all over the place, but when you know the right ingredients at the right dose, you're going to find that you can get the application. What is therapeutic dosing? Again, how much do you use and at what time? We should ask and ask again. And this is the one that I'm going to spend a little bit of time on in the beginning part of this, because I'm going to go through a few therapeutic case studies of where I had to ask the patient, then ask the patient, then ask again. Before we go to lunch today, I'm going to give, I don't want to call this a test, but I actually gave it to Tracy yesterday. I have a 65-year-old patient that came in, and we wrote down a lot of the issues with him. And I'm going to take you through my interview process with him. The first set of questions I asked, the second, the third, and the fourth. And then I'm going to show you how I basically directed his care to try to match his goals as well as the goals that I helped him to set. Did the patient come with a diagnosis? Remember, in this field, some of us are in the medical field that have a license that allows you to quote unquote diagnose something. It's one of those gray areas. And early on today, we were talking about how I was visited twice by the FDA as an investigative problem and dancing through that. But there's a lot of other investigative people out there that will come to your practice and try to find out whether or not you are diagnosing something. You know, if they come with a diagnosis, that's the perfect concept. Trying to find that out and trying to get that information back from their physician is a crucial, crucial factor. What are their complaints? You don't just want the top one or two. You want all their complaints. I tell people, give me the top 20. Give me everything in a perfect wish list that you want. I want all of them so that we can try to sort through them, find out which one of those complaints are applicable, which ones we can try to help. When to detox? That's a big term for us. When do you detox? That's, you know, people talk about that and say, okay, let's talk about heavy metals, let's talk about limes, let's talk about gluten sensitivity, let's talk about liver congestion, you know, and all the above. The need to come down to their level. This came up in the discussions as we sat around a table. We like to be up here as the medical practitioner trying to give people the information, trying to give them, here's what you need to do, and we're looking down on them. Oftentimes, and it becomes very important to get down to their level so that they can understand you and make sure that they leave with the proper understanding. Never make promises, but give hope. And you're going to see that in a couple of the case studies that we have, is that it becomes very difficult at times to say, I guarantee you that this CBD is going to make sure that your fentanyl patch goes away. It worked for me in one case, and I'm going to now utilize that therapeutic dosing in a lot of other cases, including my wife. My wife just got out of the ICU a couple days ago, and she's home on her own right now. She just had major spinal surgery. She had major spinal surgery that she had to go to Pittsburgh for because no one would touch her. She had, for those of you that understand human anatomy, a complete rebuild of her complete cervical spine, a new attachment put in at the base of her cervical spine into her thoracic spine, and then again joined that to T1 through T5. So she now has 42 different pieces of metal put into her body. And she's now 3.5 inches taller than when we got married. Okay? She sets off every bell and whistle as we go through the airport. In making sure and schedule follow-ups, this is the biggest mistake I've made over the last 36 years, is that I tell my staff I want to see a follow-up in 30 days. And oftentimes, trying to get that patient to come back because they came in to see you, they're going to pay you for that visit, they're going to spend some time with you, and a lot of times they just want to go out the door and never see you again. But it becomes very important when we schedule follow-up times that we understand fully. We need to see them so that we can figure out what kind of progress that we're making. Ordering the correct testing, how, when, and why. That's going to be a theme that you're going to see go through a couple of the case studies that we have. Now, in order to really delve into correct testing, I wanted to pick the most common medical condition in the United States, and that's arthritis. And I'm going to go through some slides very quickly because most of this you already know. It's the most common medical condition in the United States. It's number one. It's the number one reason for doctor visits. Number one. It's more money spent on this than any other health condition, including cancer. So when you look at the dollars spent, this is it. It's estimated 7 out of 10 Americans past the age of 45 are suffering some form of that or another. Should be the most common situation we encounter. If it's happening worldwide, nationwide, keep that in mind when patients come in. They may be coming in because I just failed a mammogram and I need help in determining what I do to prevent breast cancer. That may be their top priority. Arthritis may also be a sub-chapter in there that you make sure that you understand. Osteoarthritis, who can get it? Basically everyone, 20% of the entire population have it. The symptoms are obvious: swelling, inflammation, deformity. The causes, when you look at the causes of this: heredity, wear and tear, weight. Don't forget that. They may not have been born with osteoarthritis. They may not even have the heredity part of this. But we're now finding more and more with the obesity epidemic that we are beating up our joints dramatically. Injury, any other disease state. Were they diagnosed? Was it just symptoms, or do we have x-rays to back up what's going on? And again, most of us aren't radiologists. We don't have that specific technique to be able to look at an x-ray and understand this. So one of the things that I've done is one of my mentors, I ended up as a patient, I volunteered my time to do a consult with the head of radiology for the local Piedmont hospital chain. He's a good friend of mine now. And he has been very willing to take x-rays that I'll just text to him. He'll look them over, he's not making a diagnosis, and he'll give me some insight. So having, if you could, a radiologist as part of your staff, and believe me, there's a lot of radiologists out there that are willing to be able to work with you if you just ask. Osteoarthritis, non-inflammatory degenerative condition of joints, is characterized by degeneration of articular cartilage, formation of new bone, i.e. osteophytes. Nothing new there. Again, recognizing some of the signs and symptoms so that you can make a determination whether or not this is osteoarthritis versus rheumatoid arthritis or any other debilitating part of that. And that's why we wanted to give you a copy of these slides. It's just another little piece to hang on, especially when you see this. You don't have to look at the name so much, but these nodes that show up on the tip of your fingers. If you want to see an example, you can look at my hands. I played 1 year of professional football many, many years ago where I beat up my body dramatically. And some of the effects of the broken bones that I had in playing that 1 year are still haunting me today. So I've had to deal with joint issues most of my life. Common in weight-bearing joints such as the knees and hips. It's intriguing now, the newest surgery for hip replacements has now become